Okay, well, I want to talk to you about women. From the medical point of view, women are not so healthy. In fact, the saying goes in the standard medical business is women get sicker, but men die quicker. That makes sense to you? They always talk about how men die earlier in life and their wives outlast them. Well, but they're sicker during their entire life. So, the woman does have a lot of trouble. I mean, you would think that, if you had a really sick mind, you would think that the creator of the female gender was a man who didn't like women because the female was designed with so many weak parts of the body. Typical Western woman can't deliver her baby. Her birth canal is not big enough for the baby to fit out, so you have to take it out through the top, which is a cesarean section. The typical woman, her breasts are painful and cystic. And then 1 out of 7 women, the breast disease deteriorates into breast cancer. Her body is typically over fat. Women are, by number, suffer from obesity greater than men do in our society. Not only just over fat, but obese. Women take that title. So maybe there's a problem there with fat metabolism in the design of women. They have uteruses that don't work out so good either. They have these menstrual periods, which are, for a lot of women, are very painful, very heavy, often filled with clots. And then the uterus breaks down into tumors, non-cancerous tumors called fibroids. Half the women, by the time they get to be 50, have fibroids of the uterus. And then too many women have cancers of the uterus. Again, another organ poorly designed that must have been on the creator's day off. And their bowels, good grief, we have to give women all kinds of problems because a very common complaint. In fact, I learned in my early medical education, I don't know what doctors are taught today, that irritable bowel syndrome is a disease of neurotic middle-aged women. And the way that it ought to be treated is with tranquilizers. Women have all kinds of problems when they go through menopause, hot flashes, depression, poor feelings of well-being. That's a tough time in life. They don't start having heart disease until they're done with reproduction. Somehow, this creator, God, loves women who can make babies. But once you pass through menopause, you suffer the same risk of dying of heart disease as a man. So once you've foregone your reproductive abilities, you're off the favored list. The bones of a woman, they don't stay together very well. In fact, 70% of women, by the time they get to be 70, have problems with bone mineral density that classify them as having osteoporosis or osteoporosis. And cancer of the uterus, the ovary, the breast. Good grief. So you could take the attitude that women were designed incorrectly, and every time a doctor says to you, when you ask, what is the cause of my problem? The doctor says to you, it's inherited. It's your genetics. That's what you're being told. You got bad genes, lady. Or you can take the attitude that after millions of years, nature designed the female vessel perfectly because of her innate, inherent biologic purpose, which is to carry on the species. She has to be tough. She has to be strong. She has to stay alive long enough to take care of the next generation. It has to be that way. It's that way every place else in nature. But by the first half of their 9th decade, half of women will have heart disease, strokes, or cancer. In other words, you're on your deathbed. All right. That means by the time you're 85. So I've written a couple of books that are primarily focused on women, HA, and they're the McDougall Program for Women, which I own. It's been passed on from the book company, which was Penguin Putnam at that time. It's Dutton Penguin Putnam now. That book was in the top 5% of sales of that company at one time. And the other book that I got back from my original publishing company, New Wind Publishing, which I wrote, oh my goodness, about 40 years ago. 37 years ago. That's what I wrote 37 years ago. I own the rights to that book. And what I'm going to do is I'm going to give both of these books away, AJ. But I'm just going to give away a challenging second opinion now. And later on, when we give other lectures, like maybe when I talk about breast cancer or osteoporosis, I'll give the other book away free. But you can get this book, no gimmick, no charges, no heavy advertising. You can get this book by going to my website, drmcdougall.com, and you use a forward slash checkout, and this book will be available for you at no charge, and you can download it. And then what I encourage you to do is to send it to everybody you know. Send it to all your doctors. After you read it, you'll see why I called it a challenging second opinion. And remember, I wrote this when I was a young man. It took me 6 years to write this book. Anyway, that book's available now. It is about women, talks about osteoporosis, breast cancer, and all kinds of other issues that are important to women and to the men in their lives. And the McDougall Program for Women, I'll make available for free sometime in the near future. Right now, you can get it for $10 on our website. All right. The beginnings of problems we see in little girls. Little girls, because of the Western diet, are going through precocious puberty. Precocious puberty. What we find is that little black girls are going through puberty. What we find in a study of 1,777 girls, of which 90% were white girls and 10% were black girls, is we find that at age 3% of black girls are going through puberty, which means they're developing pubic hair and breast buds. 3% of black girls at age 3, 1% of white girls at age 3. By 7 years of age, nearly 30% of black girls are going through puberty. 7 years old. 7% of white girls. And by 8 years of age, 8 years old, nearly half the black girls are going through puberty. They're developing breast buds and pubic hair. Why is that? Is that right? Are there any problems with that? Any disruption caused in your family by your children becoming adults 4 or 5 years younger than they should be? I think so. Well, this has changed. This is something that's changed over the last 150 years. We've had records. For example, in Norway, in 1830, the average onset of the first bleed, that's menarche, that's when the first bleed occurs, was 17.2 years of age. In 1950, it was 13.2 years of age because of the richening of the Western diet. In Britain, 1850, they started their first bleed at 16.5 years. The year 2000 at 13.7. The United States, the little girl started her period at 14, and now she starts her period, much younger, 10, 11, 12 years old. In Japan, which we have recent records of, and we have good records of, in 1875, they started their menstrual period around 16. After the war, it was 15.2 years. 1960, it was nearly 14 years old. And now they're having the onset of their womanhood at around 12 years of age, like the rest of the Western world. Papua New Guinea, that's where 92% of their diet comes from sweet potato leaves and roots. 92% of their diet is from sweet potatoes. In the 1960s, the first bleed occurred in a little girl in that society when she was 18 to 19 years of age. So I guess what you should get from this is the female was designed to mature into a reproductive being at a certain time in life when she was mentally and physically capable of that. And that happened to occur about 5 years earlier than it does now. And because of the changes in the Western diet, we have little girls, and as I'll show you in a minute, little boys going through maturation 5 years, 6 years younger than they should. And this causes chaos in our society. I mean, think about what happens in your family when you have to deal with an 8 or 9 year old who's dealing with physical changes, emotional changes, desires, mental changes. when she shouldn't be going through these kinds of challenges until she's 14, 15, 16 years old. That's the time in life when you're supposed to start a family, not when you're 8, 9, 10, 11 years old. The consequence of this early maturation is an increase in teenage pregnancies. 90% of teenage pregnancies end in divorces. A higher rate of single motherhood, maturing a little girl earlier than she should be. A disruption in mother's education. She can't go to school anymore. She's got to stay home and take care of the baby. Poverty. Complications of pregnancy are much greater in these younger girls, children, before they're physically mature and certainly mentally and emotionally mature. Would you be surprised that they have more complications? They have more preeclampsia and more gestational diabetes. And they also have more low birth weight babies and more respiratory distress syndrome and bleeding. They're 40 times more likely to die during the first month of life than a normal weight infant. You think of all the problems in your school, in your community, in your home. Don't you think it would be an advantage to take and give children back their childhood? The kids are supposed to be riding bikes and playing checkers. They're not supposed to be jumping in bed when they're 10, 11, 12 years old. There's a time for that. And by the way, I just want to add one thing, is you who are in your reproductive years, are those sexual desires strong? Do they have an influence on your life that is sometimes disruptive? You can imagine taking those powerful feelings and giving them to children. It's a crime. And the same thing happens with little boys. A study done in 2012, they looked at a group of little boys. What they found is that they're going through maturation 6 to 2 years earlier than they did in past studies. And this is signified by having to shave and the testicles getting bigger, testicles starting to enlarge. All right. And then throughout the rest of life, you suffer from more disease due to the Western diet. There's an interesting study. I just want to take a moment on it. It's a study that confuses doctors and scientists these days. It's not just one study, it's an observation. And that observation is that women who have a high risk of getting breast cancer have a low risk of osteoporosis and vice versa. And it's hard for my colleagues to understand why, unless you understand that they're both estrogen-dependent problems. Breast cancer is aggravated, at least, by estrogen. That's why women who go through menopause earlier have less breast cancer. Women who never go through ovulation don't have breast cancer. That's why one of the primary treatments for a woman who has breast cancer is take the ovaries out, lower that estrogen. That's why you're given anti-estrogen drugs like tamoxifen or aromatase inhibitors to lower that estrogen, because estrogen increases your risk of breast cancer. But you're also told that estrogen makes the bones stronger. Hey, think about that. You got a choice here. You can have diseased breasts or diseased bones, or you can fix the problem. Anyway, this is an observation that's made. Of course, the estrogen issue should be very clear to most of you based upon your previous experiences. You know that estrogen promotes cancer. So you have troubles throughout the rest of your life. It's not just not maturation. So let's talk a minute about why the diet causes the estrogen levels to go up. Estrogen, of course, is the dominant female hormone. It's made by men too. It's the dominant female hormone that comes in the form of estriol, which is the pregnancy hormone, and estradiol, which is the hormone that most women have highest levels of during their reproductive years, and estrone, which is the kind of estrogen that's made more dominantly by women after they go through menopause. But they're just a general class of estrogens. And there may be an importance for you to understand the difference in the three kinds of estrogens, but we'll see when we get into that. All right, we find, first of all, that vegetarian women have much lower estrogen levels as a result of tests of their blood and of their urine. they end up excreting more estrogen from their body. The vegetarians do. It doesn't stay in the body. We find that fat and fiber, both, in a lot of the studies when they first started them out, a lot of the studies looked at low fat, high fiber diets, which of course is the direction that we recommend, as opposed to low fiber, high fat diets. And what they found was the amount of estrogen excreted by a woman is much greater when you eat a high fiber, low fat diet. And what they've calculated, this is kind of an interesting number, is that just switching to this, which is not as low in fat as the diet I recommend or as high as fiber, it's just a moderate change. What they found was that that would result in 12 fewer menstrual periods during the entire reproductive life of a woman. I thought that was kind of interesting. I mean, if you detest having periods, and I've heard women say that they do, 12 fewer of them in a lifetime is worth working for, isn't it? Anyway, just to mention this menstrual period thing a little bit longer, is my observations have been, and I've taken care of probably 8,000 women, and probably 4,000 at least have been in their reproductive years, is that when women change their diet, they stop having clots, they stop having menstrual periods, they will have their menstrual periods closer together as opposed to being further apart. And so that's one reason you see fewer menstrual cycles in a lifetime. So you see some pretty dramatic changes occur as soon as you change your diet. You don't have to wait any more than a couple menstrual periods to see these benefits. The only thing that would slow you down would be if you have a lot of fat that you have to lose. And we'll talk about that in a minute. Independently, fiber and fat affect estrogens, but fat only affects estrogens because of its effect on cholesterol. Whereas fiber, what fiber does is it does a couple of things. One is it grabs a hold of estrogen that you excrete from your liver into your bowel. What happens is the fiber grabs a hold of these estrogen and pre-estrogen compounds and complexes them and causes them to leave through the stool. Okay, that's how the fiber works. The other way the fiber works is it changes the bacteria in the large intestine. I know you spend a lot of time talking about microbia. The microbe content, the bacteria content, virus content, parasite content of the intestinal tract is extremely important. Well, when you eat a healthy diet, you change to an environment in the colon, which involves the bacteria and the production of enzymes by these bacteria, which reduce the amount of estrogen in your whole body. All right, here we have a research paper showing that the amount of estrogen in your body and also in your stool is dependent upon the kind of bacteria you grow. And the way you grow healthy bacteria is you eat a starch-based diet. In other words, eating animal foods causes you to grow very unhealthy bacteria. All right, cholesterol is a precursor to many, many important things in our body. It's a precursor to vitamin D. In other words, to make vitamin D, you start with cholesterol and you apply sunshine to the skin and you make vitamin D. And a few changes go on in the liver and the kidneys too. Your sex hormones are also made by cholesterol, from cholesterol. And they turn into both male hormones and female hormones, both of the estrogen type and the progesterone type. So you need to have some cholesterol. Well, the human being makes all the cholesterol that the human being needs. And so we have no problem with making enough cholesterol or vitamin D or other down the line products of metabolism. But this might bring up for some of you the concern about what happens when you artificially lower cholesterol. I don't mean by eating a no cholesterol diet. I mean by taking powerful drugs. Well, one of the concerns I have with people who take statin drugs, particularly when they aggressively take statin drugs and they get their cholesterols down in the range of 60, 70, 80, is they don't have enough of this precursor, this fundamental substrate that's necessary to make vitamin D and sex hormones. Fat makes estrogen. It takes adrenal hormones and it converts them in the body fat into estrogen, primarily into estrone. So what happens is when you go through your menopausal years, prior to your menopausal years, you have mostly estradiol, which is called E2. Okay. If you get pregnant, then you produce a lot of estriol, which is called E3. When you go through menopause, what happens is your ovaries shut down and you stop bleeding. In fact, the definition of menopause is stopping bleeding. And sometimes they say after you stop bleeding for a year. So what happens when the ovaries shut down is the production of estradiol decreases and the production of estrone becomes dominant, because estrone is made in the body fat. So what typically happens as women get older and men get older, they get fatter. And each of those fat cells is an estrogen factory. And so as a result, the more overweight you are, the more overfat you are, the more diseases related to estrogen that you have, which includes what we just talked about a minute ago, is overweight women have better bone mineral densities and less risk of osteoporosis. Why? I mean, think about what we just talked about. They have higher estrogen levels. That's the primary reason. The other reason is overweight women do a lot more exercise because they have to carry around a lot of excess weight. But that extra estrogen you make also puts you up for breast cancer and uterine cancer. So anyway, that's another source of estrogen. So you've got the food. Okay, here's another source of estrogen that I find interesting, to say the least, and that's cow's milk. It used to be that if you had a cow, the cow roamed around the backfield, and you went out and you milked Daisy a couple of times a day at most. And then when she got pregnant, you gave her a break. You let her go out to pasture, you stop the milking process. But that's not the way it occurs in modern farms. In modern farms, they milk them 25 gallons a day instead of a gallon a day. They milk them all day long. If you get pregnant, too bad. You still get milked. Well, during pregnancy, you produce a lot of estrogens in the growth of that calf. And if you're going to drink milk from pregnant cows, which is what you're doing, you're going to consume very potent estrogens, mainly of the estrone type, because this is estriol and estrone. Anyway, milk products supply 60 to 80% of the ingested female steroid hormones, sex hormones. So this is a very significant part of the hormones that you're getting is from cow's milk, cheese, yogurt, etc. All right, injection of hormones. That's another way that they get extra estrogens. In Puerto Rico, back in the 1960s, little boys were developing breasts because of the chickens that were injected with estrogens. And little girls are starting their periods at like 3 years of age from the injected drugs. Since the 1950s, the FDA has approved the injection of drugs, not just antibiotics, but also hormones to promote growth and to promote a bit more efficient milk production. So the natural estrogens that they inject are the ones that are in people, like estrogen and progesterone and testosterone, the natural anabolic drugs that they inject. And then there are a whole bunch of synthetic drugs that they inject too that never really were intended or never really did appear in an animal, but in the laboratory they made something even more potent, even less expensive. All right, you can buy these drugs over the counter. Farmers go in and they buy them without any prescriptions. In 1988, the European Union banned the use of all these hormones, but not in the United States. The other way that you get high levels of estrogen, which promotes early maturation, which promotes strong bones, which promotes more cancer, et cetera, just to bring you back to our original discussion, the other way is from what we call xenoestrogens, which are chemicals that are put in the environment that have a hormone-like effect. And there are all kinds of these hormones produced by various kinds of manufacturers. Now, I've just listed a few of those: plastics, pesticides, tap water, cosmetics. That's just a few. Now, the thing about these chemicals is they're fat soluble. In other words, they get sucked up and accumulated in fat. So as you move up the food chain, what happens is you biomagnify the concentration of these chemicals, and you bioaccumulate a whole bunch of estrogen in the body fat. So let's start with the low levels of these chemicals in the environment. Say they're on the seaweed or the algae or on the grasses and grains or in the feed. They're very low levels. And what happens is an animal, a fish, a cow, a pig, or so on, goes and eats large amounts of these foods. And the fat, because it's attracted to and soluble in their body fat, the fat from these hundreds of pounds of food, the chemicals from these hundreds of pounds of food get sucked up and accumulated in the cow or the pig's fat. And then what happens is we as human beings, we eat the fish or the cow or the pig or the chicken. Chickens are about 50% fat. We eat those foods and we end up eating, what, 100 and, I don't know, a lot, maybe a couple 100 pounds of meat a year. And I can't even think about how much dairy people eat. Well, all of that chemical is sucked up and concentrated in your body fat. You'll increase the amount of chemicals from the grasses and grains and seaweed to you by thousands fold. And the end of this bioaccumulation, this food chain, is the baby sucking off mother's breast. The Environmental Defense Fund did a study in 1978 where they examined the milk from 1,400 women in 48 states, breast milk. And they found such high pesticide and environmental poison content that they declared human breast milk an environmental hazard. You know, in the Inuits, who eat a very high animal food diet, the breast milk in the Inuit woman is so toxic that it's been declared that it should be buried in a special waste dump. 60% of a woman's pesticide load is dumped into her baby during the first 6 months of breastfeeding. You know, this is why you need to start eating really good when you're young, because you accumulate these as children, as teenagers, you know, as young adults. You accumulate these chemicals in your body, and when you get pregnant and you have your children, and this applies to men too, not just women, you're dumping a whole bunch of chemicals on the genes of your future offspring. You're causing problems, genetic defects, cancers, etc. So I did a study, AJ. I did a study on women as far as diet and breast cancer is concerned. It was the first study ever published on the dietary treatment of breast cancer. I published it. You see my name up there. It was published in Diseases of the Breast in 1984. And I pulled out a couple of charts here on what happened to women who changed to the McDougall diet. And this is, 37 years ago. And what you see there is we had a dramatic reduction in estrogen levels by switching from the typical Hawaiian Western diet to the McDougall diet. In this particular study, we published it. An overall change that was significant in the estrogen levels. So it's, I showed it 40 years ago in our patients, that by changing to a healthy diet, you dramatically reduce the estrogens. And if you happen to be raising children, they'll mature at a time in life when it's normal, when they're 15, 16, 17, 18 years of age, not 10, 11, 12. And you'll go throughout life and your organs will work just the way they should. The breasts will be in good shape and the uterus will be in good shape and the bones will be in good shape, et cetera, and you'll avoid the cancers. It's a win-win situation. Well, next time, AJ, what I'm going to do, since I showed you a study I did on the dietary treatment of breast cancer that I performed in the early 1980s, is I'm going to make the topic breast cancer. But I thought of some other topics that we could we could do in this theme of talking about medicine for women, the McDougall Program for women. And if you want to get a head start on this, I encourage you to start with McDougall's Medicine, A Challenging Second Opinion. Free, no gimmicks. Get it off our website. And you can at least get read up and get up to speed, because we're going to be talking about breast cancer, which is discussed in detail in that particular book. And by that time, I don't know whether we'll be in a position to offer the next book, but we're going to give the rest of them away free too. Thank you, AJ.
Thank you, Dr. McDougall. You know, I'm really excited that you're going to talk about breast cancer, because I recently sent you an article that they were saying that nuts help people with breast cancer.
Yeah, well, they may. Remember, nuts are not unhealthy. They're just rich. What I remember is that avocados, because they're high in fat, also accumulate a lot of environmental chemicals. But I'll have to look that up. But that's what my memory still holds, is that these plant foods they accumulate the fat soluble chemicals also, just probably not as severe as animal foods. But you know, it's just that they're in hard shells and you're not supposed to eat very many. It's just that they come in season only during a short period of time. Avocados, we used to have an avocado tree right next to our house in Hawaii, and it would come into season for only a week or two a year. Whereas I find avocados in season at new seasons in Whole Foods all year long.
One of the things you said in the presentation, which I never thought about before, because I too am concerned about young girls reaching menarche at a very young age and possibly getting pregnant, was that the cows that are giving milk are pregnant. They're pregnant themselves.
The cows are pregnant. Is that what you're saying?
Yeah. Is that the reason? Because just to play devil's advocate, if people had a cow in their backyard and drank that milk, would it be as much of a problem, or is it?
But they didn't lactate. They didn't milk the cow. They didn't milk Elsie when she got pregnant, when she was the family pet. They put her out to pasture and let her take a break. But modern milking machines, they milk, like I say, 28 gallons of milk a day, all day long. Whether the cow is pregnant or not, she never gets a break. That's the difference.
And aren't they giving the cow mass doses of these hormones and antibiotics?
They do that too. But naturally, the cow produces very high levels of estrogen because she's pregnant.
Right.
But yes, they give chemicals also. And I tried to point that out, that there are a whole bunch of hormones, antibiotics, and so on that are given in feedlots. That's the business.
Other doctors aren't, like pediatricians, they're not like making this connection.
Well, as much as cardiologists make the connection of food and heart disease, what do you expect? This is a fee-for-service business. We have no incentive to get the patients well. So, whereas things like the precocious puberty, which should make every parent, every doctor, every pediatrician up in arms, it's the main source of chaos in our society, is this premature maturation. You would think that any decent moral person would stand up and stop it. But hey, it's no worse than dropping dead of a heart attack or getting prostate cancer or rheumatoid arthritis. So why should we take any action? It's buried. It's lost in the library unless it has a profit attached to it. That's just business. That's just the way people are. There's nothing special about doctors or scientists or parents. All of us, we bring to the forefront things that are to our advantage, particularly our financial advantage. It's nature, it's normal, it's human behavior. Recognize it and do something about it. Just because things are the way they are doesn't mean we can't change them.